I think a good doctor has to wear many hats. I think he has to be an effective communicator, a good collaborator, an educator, a scholar, and a community member. One of the most fascinating things about my specialty is that I get to deal with complex problems involving the ears, nose, throat, face, and neck, and can range from anything from hearing loss to thyroid problems to the stuff that we're probably most well known for, like tonsils and adenoids. When I meet a new patient, I like to get the whole picture with that patient in terms of what their problem is, but moreover, how it impacts their quality of life. And I like to think that when these conditions are of a chronic nature, that we become, develop a good relationship over the years with certain conditions that require regular follow-ups. ENT, because of the virtue of our specialty, really hinges on development of new cutting-edge findings in both research and pharmaceuticals as well as medical devices. We've come a long way in terms of our ability to restore hearing for people who have lost it. We've also come a long way in terms of the chemotherapeutic agents used to treat head and neck cancers, as well as surgical technique. We've also found a great use for biologics for how they treat certain disease entities like chronic sinusitis. Usually, giving the best treatment to the patient involves a multidisciplinary approach. I often will collaborate with other physicians in the fields of neurosurgery, endocrinology, allergy, and pediatrics. There is no substitute for when a patient comes in and says, thank you, I now have significant improvement in my quality of life because of the treatment that I underwent. My goal with my patients, much like with my career, would be hopefully to leave the place a little better than when I found it.